Morning, everybody.
Good morning.
Good morning. So as Larry said, I'm Wendy Barr from One Medical, and I'm going to talk about our model of care, which we summarize with this very not summary statement of human-centered, technology-powered approach to developing sustainable, scalable, high-functioning primary care. All those words are really, really important, which is why we decided to stick it in the title. So a little about myself. As I mentioned for those of you when we went around, I do work at One Medical. I'm the Director of Academic Development there. I am about to have my one-year anniversary, so I'm still relatively new to One Medical. Prior to One Medical, I spent my entire career in federally qualified community health centers. From residency to every job after that. In my last job, I was the Program Director and the DIO at the Greater Lawrence Family Health Center in Massachusetts. I joined One Medical partly because I was burnt out and I saw all of my residents and graduates and faculty burned out by the current healthcare system or Michael market. We need to do something different, and it was really frustrating to be training people to do something that is so fundamental for the health of our country and our communities. My residents were leaving and saying, hey, I don't think I can do this full time. I'll work part-time. And I'll do that because I feel like I have to. I was looking for an opportunity to promote and develop high-functioning primary care for both patients and family physicians. And to be part of trying to actually change and do something, as Larry said, sort of getting really down about whether you can't change things. Also, very selfishly, I was looking for a job where I could continue to practice full spectrum, comprehensive family medicine. I love doing women's health and pediatrics and caring for women and their families, and I wanted to find a practice where that was still valued and supported and enhanced, and I got that. I do ambulatory-only practice. I stopped delivering babies, but I am still putting in a lot of LARCs and doing endometrial biopsies, colposcopies, and medication abortions, and taking care of pregnant women when they have medical illnesses, that their OBs don't answer their phone calls. So I am still getting to do all the things I wanted to do, but in a system that really is trying to meet patients' needs. In addition to all of that, I am also trying to help One Medical develop medical student and resident rotations, and with the long-term hope of developing residency and fellowship programs. In addition to that, I also do work in research with the American Board of Family Medicine on improving our training programs with outcomes and supporting GE excellence. As I said, I teach at Tufts. A little bit of everything still. One Medical is a mission-driven organization, and I think it's really important to kind of focus on what we say our mission and vision is, because it really drives all the decision-making and all the things that we do. The mission really is to transform healthcare for all, and through human-centered, technology-powered. Yes, we have a lot of tech. We are a tech company, but it really is around humans being at the center of it all, and that is really what drives things. The vision is to delight our members and to improve health and better healthcare costs for both our patients, our members, and for employers, because often many of the people paying for medical benefits are employers. We are a national company with over 25 markets across the country, over 200 locations. I'm supposed to say we also are hiring in almost all those markets. And we partner in each market with a healthcare system to improve access and coordination of care. And thinking about what does primary care mean. In addition to the model I'm talking about that I'm going to focus on today, I do want to mention we did join forces with Iora Health in 2021 to create One Medical Seniors, which is a value-based care model for patients on Medicare or dual eligible Medicare, Medicaid. But that's a whole other topic. So, I mentioned that we're a national outpatient membership-based organization. And so what does that mean? I first want to take a moment and talk about membership-based, because a lot of people, including myself, I have to say, confuse it with concierge care. When I see patients coming out of concierge care or who come to us because their doctor went to concierge care, they're telling me their doctors are charging them $5, $10, $15, $20,000 a year for the privilege of them being their patient. One Medical, the membership is $199 per year. Less if you get it on Fridays. And then most of our patients get it through their employer, and it's actually their employer is paying for those costs. In addition, we actually also have patients who can apply for financial support and assistance, and so some of our patients don't pay at all for their membership. And some patients decide they just want to see the doc in the office, they just want to be my patient. They're not really into the virtual care component of what I'm going to talk about, what the membership pays for, and they just see me as a PCP in our system. The membership fee, why we have it, it supports 24/7 care. And that helps improve access and removes the fee-for-service financial barriers to care that many of our patients have. Many employee insurance-based patients, and that's the majority of patients in the United States, many of those plans have high deductibles, co-insurance, and co-pays. And that causes barriers to care for a lot of patients. With our membership-based model, there are no co-pays, there are no billing to the insurance company, and patients can access care as they need it through the virtual medical team. And that really helps reduce costs for the patients, the overall total healthcare costs for the year for patients themselves. So I see a lot of particularly self-employed patients who have high deductible health plans for catastrophic care who really like using One Medical because they can really help control their own costs of care. So what is human-centered technology powered? What does that mean? It really means what we're trying to do is have convenient, accessible care that meets patients where they're at. Making sure that patients really feel comfortable engaging in care. It means having inviting offices that people actually want to come into and that they feel calm in and they feel welcome in. It means having lab testing within the office so you don't have to go find out someplace else where to go get lab tests. It means having unlimited engagement with secure messaging and virtual visits so you can engage with your doctor or your clinician the way that you want to, and having a highly functioning mobile app that really helps you, again, meet your healthcare needs as you want. So what does comprehensive primary care look like at One Medical? It is patient-centered, team-based, and the tech enables us to do a lot more for our patients. It's for all ages and all genders. Last week, I had a day where literally one patient was 94 years old and the next patient was 4 months old, and everything in between. And so we're really trying to meet the needs of everybody. We currently offer a care in on-demand virtual care through our virtual medical team. And this is a lot of acute care, on-demand care, treating skin rashes, UTIs, doing med refills, really keeping people, frankly, out of urgent care. And then we also have in-office care with our in-office providers or IOPs or clinicians that work in the office like myself. And these are pre-scheduled visits, either remote or in person. Usually with your own PCP, but sometimes if it's last minute. I had somebody last week, I had my 4:30 canceled, and at 4:25, someone got into that 4:30 slot because they had a last minute thing that they wanted to take care of. It wasn't my patient, but they got that slot. It was convenient for them in between meetings. So it is some urgent care as well, but really around chronic, acute care, preventive care, and being able to take care of patients kind of in that traditional primary care way. And then there are clinical programs that do wraparound services, including group visits, health coaches, virtual PT at home. We have a new program called One Medical at Home in some of our markets that does home-based care, and Mindset, which does behavioral health virtually. The future state is comprehensive, continuity, remote primary care for anybody in the country. You don't have to live near One Medical brick-and-mortar office. And this is something that we're actually working on within the next couple of months. And this is scheduled longitudinal virtual first care, really trying to, again, looking at access in places where there aren't enough offices to be able to integrate into the whole system. So the components of our model, as I mentioned, a lot is access, team-based care, really having a lot of members of the team be able to integrate and work with each other. There's a lot of training on onboarding of making sure we all learn how to communicate seamlessly with each other and support each other so that patients really get a continuous experience. The care is evidence-informed, but with a shared decision-making model so that patients really are engaged in the care that they're given. Relationship-based, again, what people want is they want a relationship with their doctor. We've all been talking about that, and really making sure that that is enhanced. Coordinating the care with specialists. We know our patients see specialists, and coordinating it with our healthcare systems. and making sure our EMRs talk to their EMRs to make that seamless. And then focusing on individual and healthcare population health as well as costs. So what does it look like as a clinician in the office at One Medical? Our workflows are designed to promote the mission to transform healthcare for all, not just for our patients, but for ourselves as clinicians. To be human-focused, to promote relationship care, which is why most of us went into primary care to begin with. At One Medical, we don't have MAs. I room my own patient. I go out to the waiting room, I greet them, I bring them back with myself, I take their vital signs. So I had to remember how to use a manual blood pressure cuff again. I give them their own shots sometimes, if that's the most convenient and efficient way to deliver care. But then patients really feel like they're welcome and they're cared for. You're also spending the vast majority of your day with your patients. Data shows that most primary care docs spend less than half their time actually talking to their patients. We spend more time talking to our EMRs. I have found at One Medical, I'm spending probably about 80 to 90% of my clinical days with my patients, face-to-face in conversations. And no, I don't have a whole bunch of notes at the end of the day because we have our own EMR that's designed for primary care to really try to streamline the way we document so that you're not having all this documentation at the end of the day. A standard appointment is 30 minutes. We have longer appointment times for certain patient populations and for procedures. And we really try to focus on starting and ending on time. Everybody's time is valued, and that's also really, really important for patients. It's something that a lot of patients complain a lot about in our healthcare system is the lack of respect of their time, and so we respect everybody's time. And as I said, you combine virtual remote visits with what you do. The way clinicians are paid is a straight salary. There is no RVU incentives. You're caring for your patient. And we also make sure that with our teams, with our tech, it really helps us make sure we're getting the notes from our healthcare system that integrates seamlessly into our EMR, and that we are supporting education so that we're all providing the best evidence-based care. I mentioned we do have a team. We do team-based care. I mentioned no MA, so who's my team? Everybody in all of our offices have lab services specialists who do labs and shots and help update the medical record and do some in-office procedures. We also have member support specialists in each of our offices, and they do a lot of the administrative work, so I'm not burdened with that, and I can spend time with patients. I haven't filled out a PA in a year because my member service specialist does it. Routine med refills are done by our virtual medical team. We have care for our complex patients. We have care navigators who help with our patients and their families and with us as clinicians, make sure those patients are getting navigated through the system and have some more touch points. We have a nursing team that helps with our lab results, our routine medication refills, and as I said, the virtual medical team can handle some of those urgent phone calls during the day to specialists and to others so that you're not being interrupted during your day and you can focus on patients. Our virtual medical team is one of my favorite things at One Medical. And really what this does is the virtual services really helps decrease patients feeling like they need to Dr. Google everything. I even have had some patients go, oh, I decided to message you instead of Dr. Googling that. And which is really great. It's what we want our patients to do to get the care and be connected with the way they want. We also do have a virtual medical team that does treat me now messages, usually answered within a couple of hours. Video visits, literally you hit a button and within 15, 30 minutes, someone comes up on the screen that's a PA or MP who can handle your issue. That really helps decrease the desire to go to urgent care because it's so much more convenient. And yes, we can convince our patients try not to use urgent care, but to use that. And because again, it's in a continuity relationship, and I'll talk a little bit more about how we really focus on compassionate communication, we're able to provide evidence-based care and still have our patients come out feeling really happy about the care that they get, i.e., no, we don't give antibiotics for that URI. So this gets to how this fits into the bigger picture. We know from the Nason report a couple of years back that we really need to reimagine and really implement a high-quality primary care system. And this is something that One Medical is really committed to being part of. We know that from Barbara Starfield's work, we have our pillars of primary care. What makes primary care my primary care? What makes primary care high-functioning and working? And I hope as I've been talking, you've heard some of those words and how One Medical is really trying to promote and really reimagine what those pillars look like to meet the needs of what our patients want and need. And that is making sure we have good access for our patients in a way that they want to access care. They need to want to come and see us and not come up. Convenience is really, really important, but you want to have convenience that promotes continuity, particularly for younger patients, so that they start building those relationships before they need the continuity for something bad happening. Comprehensive care, making sure that the care model meets the needs of all ages, all genders. Making sure it's a broad scope of practice. I mentioned all the reproductive health, but we also do a lot of gender-affirming care, HIV care, musculoskeletal care, really trying to meet the needs of patients. And as new needs come forward, there is support and move to try to expand the scope to meet those needs. Continuity, making sure people are assigned a PCP, and doing an empanelment process that supports continuity. One of the biggest drivers to decrease continuity is over-empanelment. If you have too many patients on your panel, they're not going to be able to get in to see you, and then they go see somebody else. So one of the ways that actually our panels are defined is how our access for our patients are. Do we have availability for our patients within the next day or two? If consistently no, then your panel needs to be closed for a while until your access improves. And some of that can be based on complexity. If you have a lot more complex patients, you're going to need your access is going to go down a lot more quickly because you're seeing patients more frequently. If you have less complex patients, you might have more patients on your panel because they're not seeing the patients as often. The workflows are also to maximize the time of the PCP so you build that relationship. So patients do want to come to you and not go to somebody else. And technology that further supports that relationship and doesn't cause barriers or break it down. And then coordination of care is really, really important. We've heard that a lot in the last presentation. And that you really want to make sure you have easy access to when your patients go to the hospital. As I mentioned, we have our own EMR. We're not on Epic. But I'm in Boston. Mass General Brigham is our partner. Mass General Brigham's Epic notes all dump into my system almost in real time. So I have a patient who sees a specialist in the morning. They have an appointment with me in the afternoon. If the specialist signed their note that morning, I have the note by the time I see them that afternoon. I have the CT results by the time I see them that afternoon. In my EMR, I don't have to go into Epic Physician Gateway. So that is really, really helpful. We also have our member support specialists who also help make sure we get the records that aren't from our health systems partners and be able to help our patients coordinate their care. You know, I talked about Starfield's 4 C's. I think there's another C we don't talk about enough in primary care, and that's compassion. Compassion, there's a lot of evidence that compassion improves the care that we provide for our patients. And it's often what is missing. At One Medical, this is central to our culture, and we use this by teaching everyone to communicate in all of our communications with each other, with our patients, with CI Care, which is an evidence-based method of practicing compassion. Compassion is not empathy. It is a behavior. It's a behavior that can be learned, that can be taught, that can be practiced. And I will have to say I'm pretty passionate about this at this point. My mom was hospitalized recently in a big hospital system, very well known, and I gotta say, no one ever introduced themselves when they walked into her room. No one told them who they were. No one told, I mean, it was amazing. It was like a little CI care who would have gone a whole long way to improve the quality of care. And finally, sustainability. I mentioned I came to One Medical to make sure that the doctors want to practice primary care and want to do it full-time and want to meet needs for patients. And we do that by making sure we have a schedule that's livable. Full-time is 31 hours of patient-facing care, 1 hour of CME, 8 hours to do your asynchronous virtual care. Having your compensation be based on that you're doing a good job. Having metrics that promote sustainability, looking at what's the workload on somebody, and then figuring out how you change the system to decrease their workload when it's too much. And then also making sure you have good, active professional development that's separate from your evaluation process, that really tries to make sure people grow and develop and become the doctors and the clinicians that they